My education is I am a registered nurse, oncology nurse practitioner. I am also a cancer genetic counselor, certified as an advanced practice nurse in genetics. Patients who meet certain criteria that we consider to be high risk for having an inherited cancer syndrome in their family are referred to me, or they can self-refer either way. And I then, along with the patient, sits down and we do a big detailed family history to see whether, first of all, I think that it's even appropriate for them to be tested, and then what test we want to do. The reason for that is that there's steps that we can take if we decide somebody's at increased risk for cancer to try to prevent the cancer. Most insurances cover genetic testing. Most insurances have decided that it's helpful. This is actually saves money in the long run because it prevents people from getting cancer, which is a lot more expensive than doing the test. If they say they want to do testing, that comes with counseling. And that's actually the standards. That is what the ASCO, the American Society of Clinical Oncologists, and NCCN, which is the National Comprehensive Cancer Network's recommendations, is that all individuals who are to be genetic tested should have counseling. When they make an appointment, we try to send them a form, and I just call it a worksheet, but it's a family history form that helps them to gather information so that they can talk to grandparents and aunts and uncles or whatever to try to get more information. So we sit down when they first get here and draw a pedigree, which is a family tree, but to deal with health. And I want to do at least 3 generations if we can. That's not always possible. And we just do as best we can to try to decide what it is, if the ages of the people, if they've had cancer, how old they were when they were diagnosed with the cancer, and what type of cancer. That helps to direct me on what kind of tests we want to do. The counseling session is about an hour the first time we meet. And then if it's appropriate for testing and which test, we decide which test we're going to do. We draw the blood that day. Usually it's a blood test. You can do saliva, usually it's a blood test. And we draw it that day, and it takes about 4 weeks to get the results of most genetic tests. They come back to me to get their results, whether they're positive or negative, because there's things to talk about even if they're negative. It's difficult for some patients, and that's a big part of what the counseling's for, is that you have to be able to evaluate their emotional needs with this and what it is that they want to get out of it. Once their results come in, we've kind of talked when they come for their pre-test counseling about what those results will mean and what steps we take. So when the results come in, if they are positive, then we sit down and make a healthcare plan. I share that with whoever the patient wants me to share it with. If a patient has been referred by a physician, I give my recommendations back to the same physician. But if a self-referral, I will ask the patient who they would like for me to share those recommendations on. Once we test, what we're doing is testing for a mutation or a change that's taken place in a gene. And it's a gene that's actually there to protect us from cancer. If we can identify a mutation or change that's taken place in one of these genes, then we can test other family members to see if they have the same thing. Probably one of the major things that our patients want to know if they've had cancer is what their risk for their children are. That's one of the major reasons for it. And that's one of the wonderful parts of my job, is when I can test someone and test a family who obviously has something going on. They have a lot of cancer in the family. If we can identify the gene that's increasing that risk, then we can test people in the family and be able to tell them that there is a known mutation in this family and you don't have it. If you don't have it, your children can't have it. There's no skipping a generation. That's the best part of my job.